we want to introduce you to Dr. V. We've spoken to Dr. V before, and we're very happy to have Dr. James V here. He is the pathologist-in-chief, and you may have seen him and you don't realize you saw him because in the days of COVID, when there were so many questions and so much fear and we needed so much information, Dr. V was like the spokesperson for Texas Children's Hospital on television nationally and locally. And pretty much he's like he's the smartest man at this table, that's for sure.
Smartest
right now.
and
Hi,
a
Dr.
celebrity.
Yes. Good morning.
How are you, sir?
Doing well today, and this is just always an amazing occasion this holiday season for KRB to be and our whole community around Houston and Texas to support Texas Children's. We're very appreciative.
Well, Dr. V, we are appreciative for everything that you guys do here, and and when I say everything you guys do here, that's like, okay, generalizing. Can you give somebody right now who is listening to the Rule and Ryan show, getting ready for their day, like maybe a specific thing, like some part of your day that we don't realize is a routine part of your day, and for us, we'd be like, oh my gosh, that is a routine part of your day?
Well, so many miracles are happening every day, and it starts with just children, families, women coming here and have a particular urgent problem.
And don't know the answers.
Right. Need answers, and in pathology we're delivering answers in terms of a diagnosis. And could be through testing, as we did with COVID. And in this season now, winter approaching with respiratory viruses, we're doing plenty of testing for influenza. We're seeing more flu cases every day. A reminder for everyone, influenza is here and active.
Get your flu shots.
RSV, respiratory syncytial virus. We've had over 40 patients in the hospital per day for many days during October, November.
Can we explain what RSV is, Dr. V? Because I never knew what it was until my child had it, and nobody knew what that. I remember calling the guys and telling them I'm in the hospital with my 6-week-old, which is RSV.
What is
they were
that?
like, what is that?
I'm like, I never heard of it.
It can be a very serious respiratory infection, particularly in very young children, infants, toddlers, and in the elderly, particularly beyond the age of 75. So obviously our primary concern here at Texas Children's are the very young. And we have many of these children may end up in our pediatric intensive care unit or
because how do you really? I mean, from my experience, it was 10 years ago, but really, there's no cure for RSV. It's kind of just like waiting it out.
Is it just a treatment,
because
or is there
they had
a cure?
her on a breathing machine,
right.
but they just said we have to just monitor her breathing.
So it can be very difficulty breathing, bronchiolitis. Infection of the lower respiratory tract can cause pneumonia, can be life-threatening. These patients, particularly infants, toddlers, may need to be hospitalized because they need supportive care.
And people don't realize how they get it, Dr. V, because for an infant, you're thinking, you brought your infant home. She's 5-6 weeks old. He's 4-8 weeks old. You're not going a lot of places with your baby. I mean,
especially the first 3 months.
Right. So that's why I was so shocked at 6 weeks. We weren't even taking her anywhere, and she got this. Yeah. How do you get RSV?
Well, otherwise, healthy adults and older children in the household could just have something that looks like the common cold.
Yes.
Cough, sneezing, a little bit of fever.
And it doesn't affect
congestion, runny nose, and that just physical contact, surfaces that may have the virus, hands holding the baby,
what
holding a
preventative
toddler.
measures can you take?
Well, so staying home if you're sick, of course, and not spreading the infection to others, and thinking about at school too. We, of course, have ways of immunizing children now, and more since 2023, just last year.
Yeah, that's pretty new, right? To get an RSV vaccine?
So certainly we encourage parents to talk with their pediatrician. Here at Texas Children's, of course, we have ways of immunizing children. We have vaccines during pregnancy, too, in our pavilion for women. So women in their 3rd trimester can have a vaccine that can help prevent passing that infection on to a newborn.
While you're talking real quick, Dr. V, let me throw the number out again, because people are saying, what's the number to donate? What's the number to donate? The number to donate is 1-800-234-6217, or you can text us at 51555, put KRB in the text field. Any donation that you can afford, we will take it. As we speak to Dr. V here at Texas Children's Hospital, he is the pathologist-in-chief. He has a world of knowledge, and we're talking about RSV right now because a lot of people didn't know what that was until COVID came around. And Eric, you had a question?
I just when you meet people every day, like maybe you're out to dinner and you meet some new people and you tell them you work with Texas Children's, I bet you run into people saying they have a story. Everyone has a story about somebody they know, if it's not them or their child that has been to Texas Children's. Do you see that every day in your life, that someone's been here and you're part of that? Helping miracles happen every day? Yeah,
we've seen so many stories. I mean, first of all, this place has trained more pediatricians in the state of Texas than any other institution. We're talking about a children's hospital that's elite across the country, and ranked in the top 5 in the latest U.S. News rankings of 9 of 10 subspecialties in pediatrics, and all 10 in the top 10. And then what I would say further is when we hear about miracles, this is the hospital with the most pediatric solid organ transplants, heart, lung, liver, kidney, of any children's hospital in the United States. Beyond transplantation, the largest comprehensive cancer center for children. We see so many children coming with leukemia and other cancers, and they have a chance here. This is a place of hope, right? So during this holiday season, we provide hope to families, and we have many families that come to us and say, you know, I've had my child here, and this place saved my child.
Many nurses,
nurses
people that
are fabulous.
they end up growing up. They were here as a child.
Kids that were patients grow up to be
they want to
nurses
be here
and
to
doctors
work.
here.
Yes, we've had, yes, exactly.
That's
They
pretty cool.
got care here, they come back here, they're a nurse here, they're a physician here,
So
they're
I'm just thinking,
part of the care team.
Because all these people that talk to you, I mean, and they're listening right now, this is the perfect time to donate to do something.
Yes.
Like, I can't be a nurse. I'm not smart enough to be a nurse or a doctor.
But
I
can
can
make a
donate.
difference.
I know how to
Right.
type on a phone.
So that number again is 51555 to text to put KRBE in the field, and you can choose the amount of money. You can become a miracle maker where it just comes out of your bank account or gets to your credit card every single month without you even thinking about it. So whatever amount you can afford, you can also call the hotline at 1-800-234-6217.
Dr. V, there's currently 855 patients, children in the hospital. How many patients go through the doors of Texas Children's on a yearly basis?
Do you know that
do you
number?
see-
Boy, I don't have that offhand, but clearly we have more than 100 care locations spread throughout the greater
So it's
Houston
not just
area.
right here in the
Yeah.
med
And
center.
in
This
Austin.
is the
Right.
flagship right here.
Yeah.
This is the flagship in the Texas Medical Center since 1954, so 70 plus years, since February now, more than 70 years, nonprofit serving children. We have, since the beginning, the mission is caring for children and families regardless of the ability to pay. That is central to the mission. It's why we raise funds to care, because we provide plenty of charity care every day, every year. And now we've extended that to Central Texas, to Austin. We now have 4 hospital campuses.
Wow.
We have many locations providing primary care, Texas Children's Pediatrics. We have urgent care, and obviously we have the premier emergency center for children needing emergency care here in the medical center, but we also have emergency centers in the Woodlands, near Katy at our West Campus, and out in North
Are
Austin.
you having to travel around to all the different?
Yes.
Honestly,
Yes.
I have
This is
always
all
wondered,
campuses.
like, what is, like, take us through your day real quick. I mean, because here you
Because
are,
here you started with us already at 6 a.m.
6 a.m. I mean,
Yeah.
what's a
What's a meeting
typical
like?
day?
Yeah, what's your
a
full
typical
day like?
I mean,
Starts early, you know, prior to 5 a.m. We're getting the census reports from the hospital, really keeping an eye closely on how we're performing in my department in pathology, making sure we're providing all the diagnostic testing. We've got all the staffing. We've got all the physician coverage, making sure that our teams are obviously linked with all of our clinical colleagues. We've got our blood banks. We're ready for transfusions for any major bleeding episodes. We've got working with our surgeons to make sure our pathologists are ready to provide a diagnosis during and after surgery. And then working with my physician colleagues, other physician leaders, making sure that we're not only taking care of patients today, but it's also about research and taking care of patients tomorrow. Can we do things better? We're here not only providing care for obviously plenty of patients that need our care today, but also thinking about how we can advance care for patients, whether they have cancer, infections tomorrow. Can we
you're
advance?
never turning it off.
Never turning it
Never,
off.
you
I
can't.
always think of someone like, I have this idea, Dr. V, I think I could do this and this. And you're like, all right, go for it. Let's see what we can do in the future. You got to.
Absolutely. You think about, March 2020 when we launched COVID testing, we had to move quickly like many hospitals, but we were geared to children too, and of course adults, women in our pavilion, during pregnancy, outside of pregnancy, of course. And that's important to stress the work of our fetal center. This work begins before birth and then through adolescence, through age 21, and now, of course, many children that continue to get care here even into early adulthood.
Yeah, we were talking about we're going to meet one of the patients later she was born in 1973. She got care here for her heart, and she still gets care here because you follow them throughout their lives.
Right. We have an adult congenital heart disease center here. We're taking care of adult patients, some of whom have difficulty finding a physician who may care for them. And they've been getting care here for many years. They're comfortable with our subspecialists. They're getting elite care here, and we continue to care for them.
It's Dr. James V here on the Rule and Ryan Show on 104.1 KRBE. We are live at Texas Children's Hospital today. It is the one day we ask you for help, guys, for the whole show. Our entire show is dedicated to Texas Children's Hospital because every dollar we raise stays right here.
What would you like to tell Dr. V? What would you like to tell everyone listening right now that maybe they're thinking about donating to Texas Children's? What would you like to tell them?
Well, I want to just highlight how we have just been embedded in our community. We are part of Houston, the Texas Medical Center. We are based and work entirely here in Texas, and we rely on the support of our generosity. Texans are so generous, and that has been a big part of our story throughout. We could not be here today where we are without philanthropy, without donations.
Right.
We rely on that as a nonprofit, providing charity care, providing care for so many children, and advancing research and teaching and training the next generation. So we are so dependent on your support in the community. We're so grateful. And during this holiday season, just consider Texas Children's and what you can do to help children here in Texas.
Because there's nothing scarier than having your child not feel well or be seriously ill and you don't have answers, and then you're worried, how am I going to pay for this?
Yeah.
I can't pay for this. How am I going to take them there? I can't pay for this. That's why we're here today to raise money. Dr. V, do you have global patients? Do people from around the world come to Texas Children's?
They do. We have many patients coming from Latin America. We have a whole program in global health, and some of that is in Africa and Latin America, and helping provide and train physicians, nurses in other countries. So this extends beyond the Americas, but we have many patients coming here for care as well from overseas.
Because everyone knows the reputation of this hospital. That's where you know you're going to get care.
I just got that number. So you have 4.9 million people go to Texas Children's per year. 4.9 million encounters.
All the campuses.
Yeah, when you throw it all together, and 7,000 births.
And I gotta say that the doctor has.
That's got to be per month, though.
Says
7,000
nearly
per month.
7,000 births annually.
Right. We have a capacity of nearly 1,000 beds.
Yeah.
Specifically, that number right now is sitting at over 960. We have most of those beds in the Texas Medical Center, but we have inpatient beds in the Woodlands near Katy and in Austin. So we're providing care for so many, both inpatients and outpatients in our clinics.
And Doctor, coincidentally, Johnson V has donated $104.10, just like we asked for.
Yes.
And we have so many miracle workers that you've motivated just the last couple minutes. Seba G from Katy, Stacy S from Willis, Brittany P, Don G out of Freeport, just in the last few seconds.
I just love that word,
Miracle
miracle
makers.
makers. It's so easy, and it's something you
Miracle
can say.
makers.
It's easy to say,
And it's so accurate.
Yep.
Well, Dr. V, we really appreciate the time that you've given us to open our eyes to, what you do here and the importance of all the programs and how much philanthropy goes into making it happen for a family that comes here with a child that they need questions, they need answers to their questions, and they don't have to worry about the money for it. And that's why we're here raising the money. So God bless you, sir.
Happy
holidays.
Thank you.
We'll let you get back to your very important job, Dr. V. Thanks for hanging out with the Rule and Ryan Show.
Appreciate KRB.